Good morning, everybody. Nice to have you with us. Going to 27 at night, 29 in the day, which means another full night's sleep of sweating tonight.
We have a nice glow while we're sleeping.
Yes, we do,
It's quite
don't we?
attractive. Well, that's if we're sleeping. We're hoping that we're actually sleeping through the night. We've got Dr. David Merrell in with us this morning. He's here in Calgary, but he's a dentist trained in dental sleep medicine. So he knows whether or not you're getting a good night's sleep and also what you can do about it. So today we're specifically talking about snoring and sleep apnea and when it becomes a problem and different things you can do about it. Thank you so much for coming in today.
Good morning, thanks for having me.
Now, we wouldn't normally associate dentistry with sleeping. How does that fit?
There are only a small number of dentists in North America that are involved with this, and I got involved because
There we go. I'm just going to use a microphone for you. Yeah.
Because my father was diagnosed with this about 12 years ago, and so that sort of prompted me to get into it and investigate it more. And I've had to travel quite a bit and to get educated, train in the States, things like that.
Okay, so let's talk about sleep medicine, exactly what it is. Like you can actually know in a night whether or not somebody's got a problem with their sleep, what the disruption is. Tell me about that.
That's correct. We'll do a physical assessment of the patient in the office and then send them home with a home sleep recorder. And they hook up a few simple leads, sleep overnight with it, bring it back the next day to our office, and then we'll email that information over to a sleep specialist. And working with the sleep specialist, we'll come up with a diagnosis and know if it's just simple snoring or if there's something more common that's going to happen that's going to affect their health.
So how's that different from the sleep clinic that we hear about?
Well, the sleep clinics will say, for example, at Foothills Hospital or some of the there's one private one in the city as well, and those centers you can go and stay overnight in the hospital, have a much more sophisticated test done, but the final result works out the same even with a home sleep recorder. That they're very comparable for their results. But those centers also use the home sleep recorders. It's well-established therapeutic measure.
So it's the same thing.
And when is snoring a problem?
Simple snoring isn't a problem, but snoring's a sound that's generated by your airway, and it means that the air is not going and you're not breathing properly. And we all need to breathe to be healthy. It's that simple.
It's pretty straightforward. That oxygen, you kind of need it, don't you?
That's right. Yeah.
But my husband, I find he's a huge snorer when he's really tired. So when you're really tired, how does it affect this area?
If you're very tired, if you've had a couple of drinks of wine, if you maybe took something because you had a headache or you're some sedative to help you sleep, that will increase the deepness of the sleep and relax the muscles more, and then you'll get more snoring or more blockage in the airway and possibly obstructive sleep apnea.
And then that actually becomes less good of a sleep.
Well, certainly, yeah, because besides the airway blockage and that factor going on, your brain is registering that your body's fighting, trying to breathe, and it creates arousals in your brain, and then your brain doesn't get the deep sleep that it needs for the rest.
So you just mentioned obstructive sleep apnea. What is that exactly?
That's where the airway collapses to a degree to prevent the normal airflow, and it could be something as simple as a nasal blockage. Young people, tonsils, adenoids, things like that. Could be a large upper uvula palate area where the tissue is a little bit larger anatomically, so it could just be hereditary factors. When you go into the deep sleep and your tongue relaxes and it goes back, that'll also block the airway.
And it's where you actually stop breathing for a second. Is that accurate?
Well, it's more than that. It can be up to 100 times an hour. It can be from 10 seconds to a minute. And some people's blood oxygen...
You're not breathing for a minute?
For a whole minute. Some people's blood oxygen will go down to 70%. Normally, when we're alert and awake, it's around 90. So
that can't be good.
So how do you know if you've got sleep apnea?
Well, taking a simple test it gives you some indication, but you really need to work with the medical community as we do, using the home sleep test or an overnight test at a hospital, get all the information together to form a diagnosis and assess how that person is.
And is it accurate that people say you don't even know you have sleep apnea? A lot of people don't till they get married or till they're with somebody, and then the other person tells them.
Oh, that's right. It's very common. It's about 20. Studies show it's up to 20% of the population. So that's huge numbers.
Yeah.
And people will deal with things. They may feel a little tired. They might have a headache. They might have a bit of heartburn, and just think, well, that's just life. I'll live with it. But now we know there's research to show that there's increased incidence of those things I mentioned in people that aren't sleeping properly.
Okay, so you say indigestion, stomach ulcers, what else?
Headaches,
Headaches?
just tiredness, hypertension, those sort of things are an indication that something's not right with the way you're sleeping at night.
And would I feel those in the morning or just throughout the day? I tend to get headaches, or how do I know that maybe there's a sleep issue?
Well, the tiredness for sure, as well as if you wake up at night and you're kind of choking, you gasp, or if you're a loud snorer. Those are all indicators, but we have to piece all the information together.
And we're going to talk about things you can do to help yourself in the case that you do have it. But what happens if you don't treat it?
Well, in some people it's fatal, and it'll increase heart attacks, stroke, hypertension, coronary artery disease, things like that.
And fatal if you're driving. I just think if you're not getting a good night's sleep, those kind of things can be
Sure.
dangerous.
People with sleep issues related to this have 6 times the number of traffic accidents. And the person that invented one of the most successful dental appliances was almost killed in a traffic accident because he falls asleep so often. But once with the proper treatment in the dental appliance, he's
fine.
completely healthy.
Really?
No
Okay.
tiredness issues.
So let's talk about some of the contraptions you've brought with you today. You've got the mask. Let's talk about
This
what
is
that
a CPAP machine, and this is the gold standard for treating these issues. But what they've found over the years, although it's 100% effective, that's only when you wear it. So it's very difficult to sleep with this, get accustomed to it. If people are claustrophobic, they have issues and they just won't continue with it. So
Yeah.
the studies show that although it works after a year, only about 40% of people are staying with this. And because it can have such serious health issues, this is not something you want to put away in the closet and forget about it. So
And does that train you, or is that you sleep with it every time and that's
you
it?
have to sleep with it all night. It's strapped onto your head like this, and air is forced through your
Oh my
airway to
gosh.
keep your throat open.
I can't imagine.
And romantic.
Well, as long as you have a lit candle beside the bed, you're all good.
Hey, Darth Vader, why don't you roll over here? Okay.
But another option, which is a little easier to use, it's very effective when worn, and it travels obviously a lot easier than something like this, is the oral appliances, which position the jaw, hold it forward a little bit, it opens the airway. And so you can sleep on your side, your back, turn around. It's a lot easier to
see
sleep
it?
with this in your mouth.
And so how does it work? It just holds your...
It just holds the jaw forward a little bit. This is one design. There's a number of different designs out there, but it's very effective. This is well documented in the medical research.
I don't understand how an appliance like this on your mouth and on your teeth helps your breathing.
Well, by positioning the jaw
just
forward,
pulls it-
and the
like
muscles
that?
that are attached to the jaw are also attached to the back of the throat, and it holds the tongue forward and opens the airway up. So it'll eliminate snoring, and it'll help people that have obstructive sleep apnea.
Wow.
How long does it take to get one of these put in?
Well, to do the full diagnosis, the
Yeah.
sleep study, and have one of those made up, and then do a trial fit and then a restudy, can take about 6 weeks.
And is this something that's covered at all, or is that something you're going to be paying for typically?
This isn't in our province.
Yeah.
It isn't covered by Alberta Healthcare. In Ontario and Manitoba, they'll pay for the CPAP machine and they'll pay for the oral appliances because they're very effective. So it does depend where you live.
Right.
But both of these costs are about the same. It can range from $3,000 to $5,000 for a CPAP machine, and these have to be replaced and refitted continually. And an oral appliance the same. It's about $3,000, and the oral appliance is good for about 4 to 5 years.
Okay, we have a website people can go to if they'd like some more information. It's quietsleepcalgary.com. Quietsleepcalgary.com. What are we going to find on the website?
There's information describing what snoring is, obstructive sleep apnea, some of the common signs. There's also information in there to contact us if people would like literature sent out to them.
I think I'd like to try the overnight thing.
Is
I
that
want to
right?
know what's going on. Well, I had a high score on my test.
So now let's explain this. And I was explaining this test on air about Tara being really high. So what is this test?
That's the
high
Epworth
score.
Sleepiness Scale.
Is that what it is?
Yes,
Different.
not high.
Okay.
And there's 8 questions, and they're ranked 0 to 3. So if you up towards the 24, that's a high score. And secretary had the 18, so
She's up there.
Well, you said anywhere from 8 to 10 is normal.
yeah, that's
Right.
not a concern if we come across that measurement. But if you start getting in the higher teens and certainly the 20s, then that would indicate that you have a tiredness issue.
And is this on the website, this test?
No, that isn't.
All right, here goes. I'll say it really fast so people can get it. So this is 0 is you would not fall asleep. 3, you would fall asleep. Sitting and reading, Tara said.
3.
Watching TV, Tara said.
Oh, 3 for sure.
Sitting inactive in a public place, theater or meeting. Very good. As a passenger in a car for an hour without a break.
Oh, yeah.
Yeah, for sure. Lying down to rest in the afternoon when circumstances done.
Done.
Sitting and talking to someone.
No, I put 0 for that because I don't fall asleep talking to someone.
You wrote 0 unless it's Dave. Then 3. That just hurts.
But you need to do these too.
Sitting quietly after lunch without alcohol.
2.
Yeah,
So it's
and
not
in a
as
car while stopped for a few minutes in traffic.
Possibly. Well, I've had those moments where I do the long blink,
Yeah,
you know, so
we call that a long blink.
it's a long
And
blink.
then we call that a nap in other parts. But these kind of things are good though, and if you're a tired person, then it's worth finding out about ways you can actually get a better night's sleep.
Yeah, quietsleepcalgary.com. Thank you so much for coming in.
It's been a
today.
pleasure.
Appreciate
Yes.
your time. Okay, we're going to head out to Ashling, and I wonder what kind of score she has. Probably about